welcome to my Spinal Decompression website. I'm Dr. Ramah Wagner. I'm the chiropractic physician here at Wagner Chiropractic. What I want to talk to you about today is how to heal discs from my perspective. How this came about, I kind of created my own program for when there's a disc herniation based on my own injuries and some of the injuries I've seen over the years. I know many doctors use spinal decompression, and often with spinal decompression they don't do too much else besides a little spinal rehab. But I believe in a triune type of effect in order to bullet point in to true healing of the disc. How I like to do that is through specific chiropractic adjustments. One of the things you'll need to know is if there isn't a nice gentle curve in the low back that opens up the holes where the spinal nerves come out, if your back has a hypolordosis or doesn't have that curve in it, what you'll find is you're more prone to disc herniations or disc bulges or disc problems than you need to be. So until we manage the spinal corrective state of the spine, you'll probably have a predisposition to blow another disc by just bending over and picking something up. So we want to structurally correct your spine. The second thing we want to do is use spinal decompression, because just through chiropractic care a lot of times the discs won't move back to where they need to be and they won't heal. So through spinal decompression, which is, we have a very powerful machine that it's set just to your right amount of weight and pull, and what it does is it pulls apart at the spine and allows the disc to slide back in place over time. So that's very important, to actually move the disc back. And then the third thing I like to use is to use passive and active spinal rehabilitation, including a cold laser. Cold lasers are frequencies that can hit the cells on the disc and actually regrow on a cellular level the disc and heal the tissue, rebuild the tissue. So as we progress on the spinal corrective adjustments, adding into the spinal decompression to be moving the disc back, then healing the tissue on a cellular level, and also rehabbing the spine for long-term benefit. This way I found you don't end up paying a huge amount of money, getting your disc better, and then 6 months later being right back where you started. I truly believe that through this triune approach to disc healing, you too can have long-term change in your health and possibly even avoid surgery in the future.